Welcome back to New Day Cleveland. It is important that we allow ourselves to reset our mind and body in our lives daily, not just every month or every year, daily. But some of us need a little more help than others. And the Reset Medical and Wellness Center is making it pretty easy for us to do that. So I want to welcome in Kelly Price and Dr. Michael Louwers. Thank you both for being here today.
Thanks for having us.
I mean, just the thought of that, again, it's the whole focusing on our mental health, our mental state of mind. We focus so much on physical, but mental, I feel like, lags behind and people don't put the emphasis on it. So what is the mission at what you do there at Reset?
Kelly?
Yeah, so our mission is really to bring hope and healing to those suffering from, really mental health issues, but also long COVID as well as menopause, which is what I suffered from, but PTSD, anxiety, depression, insomnia. It's really a simple treatment that allows people to get pretty quick, almost instantaneous results in some case. So
instantaneous results.
Yeah, a lot of times.
So then we need to explain this a little bit. It's the Neuro Sympathetic Reset that happens.
Yeah, so the idea is, are you familiar with the stress curve?
No.
So that's the idea that a little bit of stress is helpful. It motivates us. But as you go through that curve, you tend to get more and more damaging effects from stress, right? It starts to cause disease, illness, and injury. And the injury that occurs is to part of our nervous system. It's commonly known as our fight or flight system. And when that system is injured, our response is to be hypervigilant. We have restlessness. We're feeling like we're under attack. And that's where we come in. So while there's a number of treatments for that, sometimes those traditional treatments like therapy and medications aren't enough. And our treatment is a really simple 20-minute outpatient procedure. We target that part of the nervous system with an injection, and it restores the balance to that system. It allows that system to function normally and starts to resolve the symptoms of anxiety or post-traumatic stress.
How did this come to be that it worked? I mean, I'm sure there's a lot of studying and a lot of trial and error that went into creating this. So it's just an injection. It's a shot. It's
a simple shot. The shot itself has been done for decades to help a specific type of nerve pain, and they found doing this in the veterans hospitals for pain, these patients who are commonly affected by PTSD were coming back having resolution of their symptoms, and so they began studying it, and now we've modified it to really benefit a whole number of patients for mental health.
That is so wonderful. So you said almost instantaneous results at times. Do you normally do it, have to do it multiple times, or is it normally a one injection and done?
That's the wonderful thing. Most patients, the vast majority, about 95%, really only need this treatment once, because once we reset that system, then they can utilize healthy coping strategies and those more traditional treatments to maintain the benefit, potentially indefinitely.
Well, and it sounds like one of those things where if people don't know about this, sometimes they just don't know something like this exists for them. So how are you, I'm guessing you want to get this out to the community, let them know about it. I'm glad you're here talking about it. But there is, I'm sure statistics would show a strong need for something like this.
Yeah, and really anybody that we talk to is like, I either need that or I know somebody that needs it, because really all of us, especially since 2020 with COVID, happened, the stress that we put on our bodies going through such a traumatic time. Just even day-to-day stressors built up over a long period of time can cause anxiety and depression, insomnia, and the insomnia relief is probably the biggest thing that everybody sees, like almost instantly. And so for the people that are out there that need it, it's a thing that we just have to destigmatize the thought that you can't talk about mental health, because all of us deal with something that we need help from. And so this is a good way to kind of restart it. And then you can go into things like talk therapy or EMDR and have such better results, because you're not ruminating and processing over and over again all the things going on in your brain.
So it allows you to cope with that stress, that day-to-day issue.
Which is so important, because again, as you said, stress affects us in so many negative ways if we let it. And so you're able to do this, and I'm guessing, are there side effects at all that come along with a shot? Or like, is there anything that people need to know, or do they just go on about their daily lives after it's done?
The injection, it's a 2-day injection, so we do it right side and left side. And the injection is just local anesthetic like your dentist might use, so there's really no lasting ill effects. And it's a very simple and well-tolerated procedure, usually just under local anesthetic.
And this would, it sounds like because
And
everybody,
it's not a vaccine.
It's not a vaccine.
Everybody's
Good to
like,
point
is it a
out.
vaccine? No, it's not a vaccine.
And a lot of the things you address, they seem intertwined, you know, with anxiety and depression and certain things, all intertwined. So I'm sure it helps with a variety. If someone's dealing with multiple things, it will change all of that.
It's kind of a snowball effect. So if you're sleeping better, like Kelly said, then your mood's better and you're more productive, your energy's better, and then you're going into the next day feeling even better and better and better. And that continues, and so it's helping things like depression and anxiety, but also a number of other health conditions. It's mind and body health.
It's impressive to just know that this is something that we can do. You can always go to theresetcenter.com to learn more, but you're in Strongsville.
Yeah.
They can call, make an appointment, maybe have a consultation, and work with these fine people there at the Reset Center. Thank you, Kelly. Thank you, Dr. Flowers.
Thank
you so much for being here.
Thank you so much.